Extract 2, questions 37 to 42. You hear an interview with Dr. Neena Kapoor on adolescent mental health. You now have 90 seconds to read questions 37 to 42.
Dr. Kapoor, thank you for joining us today. Mental health in adolescence has become a growing concern. What are some of the key issues you're seeing in your practice?
Thank you for having me. Yes, adolescent mental health has become a growing concern, with a noticeable rise in anxiety, depression, and self-esteem challenges among teens. This troubling trend is fueled by a combination of factors, including the pervasive influence of social media, which often promotes unrealistic standards and fosters harmful comparisons, mounting academic pressure, as students strive to meet increasingly high expectations, and the lingering psychological effects of the COVID-19 pandemic, which disrupted routines and isolated many young people during critical developmental years.
You mentioned social media. How exactly is that affecting teens' mental health?
Social media can be a double-edged sword, especially in the lives of adolescents. On one hand, it offers a powerful platform for connection, allowing teens to stay in touch with friends, express themselves creatively, and engage with communities that share their interests or identities. It can provide a sense of belonging and even serve as a source of support during difficult times. However, the darker side of social media is becoming increasingly apparent. Many teens find themselves caught in a cycle of unhealthy comparisons, constantly measuring their lives against the curated, filtered versions of others they see online. This can lead to feelings of inadequacy, low self-worth, and the belief that they are falling short. The pressure to maintain a flawless digital persona, complete with perfect photos, achievements, and social validation through likes and comments, can be overwhelming.
Are there signs that parents or teachers should look out for?
Absolutely. Changes in behavior are often the earliest and most telling signs that an adolescent may be struggling with their mental health. These shifts can be quite noticeable, such as withdrawing from friends and family, losing interest in activities they once enjoyed, experiencing sudden declines in academic performance, or displaying increased irritability, mood swings, or emotional outbursts. Physical symptoms may also emerge, including significant changes in sleep patterns, either insomnia or excessive sleeping, altered eating habits, or unexplained fatigue. However, the signs aren't always overt. Sometimes, a teen may appear to be functioning normally on the surface, attending school, completing tasks, and maintaining a calm demeanor, yet they may seem unusually quiet, emotionally distant, or disengaged from their surroundings. These subtle cues can be easy to overlook, especially when teens themselves are unsure how to articulate what they're feeling. That's why early intervention is so critical. The sooner these signs are recognized and addressed, the better the chances of providing effective support and preventing more serious mental health challenges down the line.
What role can schools play in supporting mental health?
Schools occupy a uniquely powerful position when it comes to identifying and supporting students who may be struggling with their mental health. Because educators and school staff interact with students on a daily basis, they are often among the first to notice changes in behavior, mood, or academic performance that could signal deeper emotional issues. This makes schools an essential frontline in the effort to promote mental well-being. To truly fulfill this role, mental health education should be integrated into the curriculum, not just as a one-time lesson, but as an ongoing conversation that helps students understand their emotions, recognize signs of distress in themselves and others, and learn healthy coping strategies.
What about treatment options? Are teens open to therapy?
Many are, especially when therapy is presented in a non-judgmental, supportive way. Cognitive behavioral therapy, CBT, is particularly effective for adolescents. Some also benefit from group therapy or mindfulness-based approaches. The key is to normalize mental health care, just like we do with physical health.
And what can families do at home?
Open communication is essential. Teens need to feel they can talk about their feelings without fear of being dismissed or judged. Parents should also model healthy coping strategies, like managing stress, setting boundaries, and taking breaks from screens. And of course, if a teen is struggling, don't hesitate to seek professional help.